Sweet potatoes are poisonous to these three groups of people? Doctors warn, absolutely forbidden. Sweet potatoes, seemingly the healthiest food called the golden food by the Japanese, can become poisonous if you belong to these three groups of people. Doctors warn, if you eat sweet potatoes incorrectly, it can cause bloating, gastritis, increased blood sugar, and even kidney damage. Today, Longevity Zen will help you understand why a good food can become a poison, who absolutely should not eat sweet potatoes, and how to eat sweet potatoes correctly to live healthily and long without harming your body. In modern medicine, sweet potatoes are considered a superfood containing more than 10 types of vitamins and minerals such as vitamins A, C, E, potassium, fiber, and antioxidants. However, a nutritionist at the Mayo Clinic once said, "No food is absolutely good, not even sweet potatoes." Because, depending on individual constitution, medical conditions, and preparation methods, sweet potatoes can go from a healing food to a stimulant causing digestive and blood sugar disorders. Let's delve into the three groups of people who should absolutely avoid eating sweet potatoes, and you will understand why the same sweet potato can make some people healthier and others sicker. Group 1. People with weak stomachs, prone to bloating and acid reflux. This group is the first and most significantly affected. Sweet potatoes are rich in starch and soluble fiber, but when eaten on an empty stomach, they stimulate the stomach to produce strong acid. The consequences are acid reflux, heartburn, and chest pain, bloating and abdominal distension due to gas from fermentation. For people with gastritis or ulcers, it can cause recurrent inflammation or even minor bleeding. According to the National Nutrition Center of Japan, raw or undercooked sweet potatoes contain a lot of raffinose, a type of sugar that is difficult to digest, causing gas in the intestines. Doctor's advice: do not eat sweet potatoes on an empty stomach. Eat them 1 to 2 hours after a main meal to avoid increased acid production. Steam or bake them thoroughly to reduce raffinose. In fact, a 58-year-old patient in Tokyo was hospitalized for prolonged abdominal pain. The cause was simply eating 2 baked sweet potatoes early in the morning on an empty stomach. If you frequently experience bloating after eating sweet potatoes, please comment, "I understand the reason," because this is an early sign that many people overlook. Group 2. People with diabetes or insulin resistance. This may sound strange, as sweet potatoes are advertised as good for diabetics, but the truth is, not everyone with diabetes can eat them. Sweet potatoes have a medium glycemic index, GI, of 60 to 70, meaning they raise blood sugar faster than brown rice and oatmeal. If you eat too much or at the wrong time, for example, in the morning on an empty stomach, glucose levels will spike in the blood, causing the pancreas to produce more insulin. According to the American Diabetes Association, ADA, people with insulin resistance or prediabetes should only eat half a small sweet potato, about 100 grams per day, and it should be eaten with fiber or protein to slow sugar absorption. Importantly, yellow or white sweet potatoes contain more starch than purple sweet potatoes, so diabetics should choose purple ones. Absolutely do not eat fried sweet potatoes, as the oil increases the GI by another 20 to 30%. Correct practice. If you want to eat sweet potatoes without raising your blood sugar, eat them after a main meal, combined with boiled vegetables or chia seeds, and no more than 3 times a week. If you or a loved one has diabetes, please share this video so they don't make the mistake of eating healthy but actually harming themselves. Group 3. People with kidney failure, gout, or hyperkalemia. Sweet potatoes contain a higher amount of potassium than bananas. On average, 100 grams of sweet potato contains 380 to 400 milligrams of potassium. For healthy individuals, potassium helps stabilize blood pressure and heart rate. However, for people with kidney failure, this is a double-edged sword. When the kidneys are weak, the body cannot eliminate excess potassium. Potassium accumulates in the blood, causing heart rhythm disturbances, muscle weakness, and even cardiac arrest. According to Johns Hopkins Hospital, USA, people with chronic kidney disease should only consume less than 2,000 milligrams of potassium per day, equivalent to less than 5 slices of boiled sweet potato. Similarly, people with gout should also limit their intake because sweet potatoes can indirectly increase uric acid due to containing oxalates, salts of oxalic acid, which when combined with calcium can form kidney stones. In addition, burnt sweet potatoes also produce acrylamide, a compound that causes arthritis and kidney damage. Safe way to eat: soak the sweet potatoes in warm water for 20 minutes before boiling. Do not eat burnt or moldy parts of the sweet potato. People with kidney disease should only eat 1 to 2 times a week in small quantities. If you know anyone who has weak kidneys and still eats sweet potatoes daily, please send them this video immediately, because sometimes a small habit can save their health. 4. 5 common mistakes that turn sweet potatoes into poison. 1. Eating sweet potatoes to lose weight, but eating too much. 2 sweet potatoes, 1 large bowl of rice, higher in calories than you think. 2. Eating sweet potatoes instead of rice all day. Lack of protein, micronutrient deficiencies, easy muscle fatigue, reduced concentration. 3. Still trying to bake moldy or oozing sweet potatoes. Solanine toxin causes nausea, dizziness, and neurological disorders. 4. Eating crispy fried sweet potatoes. Acrylamide increases tenfold, increasing the risk of chronic inflammation and cancer. 5. Eating sweet potatoes late at night easily causes bloating, indigestion, and mild insomnia due to sugar fermentation in the intestines. If you've ever made at least one of these mistakes, comment "I have" to remind yourself to be more careful. 5. Sweet potatoes, a golden food if eaten correctly. When consumed properly, sweet potatoes are still a great food. They help stabilize blood sugar if eaten in the right amount. They provide fiber that helps maintain a healthy gut microbiome. They contain beta-carotene and anthocyanins, 2 antioxidants that protect nerve cells. They contribute to a healthy brain, stable cardiovascular system, and healthy skin. Doctor recommended way to eat them. Eat 1 to 2 times a week, half to 1 medium-sized sweet potato, about 100 to 150 grams. Eat them after a main meal, not on an empty stomach. Prioritize steamed, boiled, or lightly baked sweet potatoes. Avoid burnt edges. Combine with protein and green vegetables to balance blood sugar. 6. A true story. 1 sweet potato, 2 destinies. Mr. Sato, 68 years old, from Kyoto, has had diabetes for 8 years. Every morning he eats 1 baked yellow sweet potato, thinking it's good for digestion. The result: his blood sugar spikes and he feels tired all day. Meanwhile, his wife, Mrs. Hana, eats steamed purple sweet potatoes along with vegetables and grilled fish only 3 times a week. After 3 months, her blood sugar stabilized, her memory improved, and her skin became noticeably brighter. Both ate sweet potatoes. One ate it correctly and it became a health benefit. The other ate it incorrectly and it became harmful. Conclusion and philosophy of life. There is no such thing as bad food. Only the wrong way of eating makes it dangerous. Even sweet potatoes, a common food, when eaten correctly, are a pure source of natural energy, but when eaten incorrectly, they become a burden on the stomach, liver, and kidneys. After 50 years old, the important thing is not to eat a lot, but to eat correctly, understand your body, and listen to your own reactions. Remember, food is either medicine or poison, depending on how we use it. If you find this video helpful, please like, share, and subscribe to the Thinhua Zen channel so that every week you can learn a small lesson about how to eat, how to breathe, and how to live more mindfully. Next video: 5 foods that cause brain inflammation and reduce memory that many people still eat every day.